Thank you so much, Dr. Allen, for joining me today.
It's my pleasure. Thanks for having me on.
Absolutely. Well, first of all, breast cancer, when we say that word, a lot of folks think automatically women over 40, women over 50. But first, I would love for you to discuss what what women under 40 should be aware of, younger women, when we talk about breast health and breast screenings.
Absolutely. Just to give you some background, so the average woman that has a 1 in 8 chance of getting breast cancer by the age of 75. So that's 12.5% of women are going to get breast cancer. So it's more common than people think. And 90 to 95% of the breast cancers are not hereditary. So when I hear I don't have it in my family, that's exactly right. You probably don't have it in your family, but that does not necessarily minimize your risk. Certainly, if you have it in your family, there's an increased risk. But again, the vast majority of breast cancers are detected without a family history. So, in terms of younger women, starting from teenagers to under 40, there's something that's called breast self awareness, and that's really important to know. And what it's not your traditional where you're doing a monthly self breast exam. This breast self awareness is being aware of what your breast should look like, what's normal for you. When you look in the mirror, when you're in the shower and you're washing your body and you're feeling, you're looking to see, are they more or less the normal size that they usually are? Is one different? Is the nipples retracted on one side? Is the skin texture rough or different on one side? Is there puckering on one breast? Or do you feel a lump or a pain? So I think that's the one thing that we don't talk enough about, because prior to you getting to the the mammogram age at 40, you should be aware of what's normal for your breasts, what they look like, and if there's a change, because the majority of breast cancers in women under 50, 70% of breast cancer diagnosed are picked up by the patient. So that's a lot. That's more than 2/3 are picked up by the patient. So the only way you're going to pick that up is if you are feeling to see if you have a lump. Most lumps are going to be benign, but not all. And the only way for us to know is if you come in for us to check it out. So that's what I would say is probably the most important thing for women under 40. Also, getting a clinical breast exam, meaning by a gynecologist like myself or a primary care doctor if they're comfortable. Those should start at age 25. So 25 to 39, women should have a clinical breast exam by a licensed practitioner every 1 to 3 years. And then 40 is when the mammogram starts. So at least you're getting something before that.
Okay. All right. So now let's move ahead to the 40s, mid 40s. What is the current recommendation? I know there's been a lot of talk in the last couple of years and people might be confused. So what is the
Yes.
recommendations?
And the confusion is it depends on what entity you're looking at. American Cancer Society says one thing. Kaiser has their own recommendations. So what I go by what the American College of OB-GYN says. So for gynecologists that are board certified like myself, that is our gold standard. That's what we go to. And they also have the same guidelines as the United States Preventative Task Force Service. They're in alignment. And what those guidelines are, and they just changed it because a lot of people were saying wait to 50. They have just now said 40 is the age when you should start. Reason being, the last few years, there's concerning increase in breast cancer in women in the 40s. So if we're waiting till 50, we're going to miss a huge population of people. In fact, 1 out of 6 of invasive breast cancer diagnosis, 1 out of 6 of those women are in their 40s. So the new guidelines say start at 40. And you can do it every 1 to 2 years, from 40 to age 74. Beyond that, so 75 and beyond, you talk to your doctor. If it's someone who's healthy, a healthy 76-year-old, and you're thinking their life expectancy is at least 10 more years, then it may make sense to keep getting them done. People are concerned about getting radiation all of those years over and over again. Mammograms have a very low level. It's a low level X-ray essentially. So it's not. CT scans are very high. Actually, that's a lot of radiation. You have to get a CT scan of your body. So these are low level. So I don't want that to be a deterrent for people. But 40 is the age. We feel that earlier diagnosis means earlier treatment, earlier stage, less invasive treatment. So maybe just a lumpectomy, removing the lump versus an entire mastectomy versus the whole breast. Maybe no chemotherapy if it's getting diagnosed earlier. Radiation may or may not be necessary. So it's really important to start them at 40, or at least have a conversation with your doctor. And back to your question about women younger than 40, ask your doctor, when should I be getting it done? What's my risk of breast cancer? Because depending on if you have risk factors, you may need it done as early as 30. And so you need to have that conversation with your doctor so they can get your history to see when it's time for you to start. But the average risk woman, age 40.
Okay. All right. Now let's hone in specifically on African American women. I know
Mm-hmm.
in general, more breast cancer mortality and younger. What should African
100%.
American women be aware of?
So you're right there. So two things. Women, yes, have the highest breast cancer death rate among all women, even if you factor in stage and age, so stage of the cancer and their age, even if you make those equal. And one other thing that's really important that I don't think a lot of people know is, so there's different types of breast cancer. The most common are estrogen receptor positive, progesterone receptor positive, and maybe HER2. A lot of the treatments are targeted at those sort of breast cancers. Those have better treatment options because you can put someone on an anti-estrogen to help fight that type of cancer that we know is responsive to estrogen. You can put someone on a medication against HER2 if we know that they're making a lot of that. There's a triple negative breast cancer, which means you don't have any estrogen receptors in that cancer, no progesterone receptors in that cancer, and no HER2. Harder to treat. Black women have a higher rate of these triple negative breast cancers. They occur in younger women and they're much more aggressive. We don't know why this is happening more in Black women, but those are more on a microscopic level. It starts spreading right away. So when people are diagnosed, it's much more advanced. By the time you have a lump, it's already in the lymph nodes, it's already gone to other places. Whereas the other types of breast cancers usually feel something first and it's still maybe local. This is a much different beast. Do they have a family history? Do they have anyone in their family that has BRCA gene, BRCA1 or 2, which is an increased risk for breast and ovarian cancer? Do they need to be screened for that? Have they ever been exposed to chest radiation? Maybe they've had a skin cancer or something. If they've had chest radiation earlier than 30, that's a risk factor. So there are lots of things. So Black women need to talk to their doctor, see what their personal risk factor is. They need to know about maybe checking their own breasts and what to look for. Again, that breast self-awareness, that needs to be a discussion. We need to dispel a lot of myths that, well, mammograms are going to be very painful. It's uncomfortable, but it's brief. Again, the radiation dose is not high. A lot of women are concerned about, wearing underwire bras. Will that increase breast cancer? No, it won't. What about deodorant, aluminum? We've been using this for a lot of years, and so far there's no data that says that that's going to cause breast cancer. So I think we need a lot of education among Black women so that they're aware of the facts and aware of their risk. Because again, not having a family history doesn't mean you're not at risk. What ACOG has done, American College of OB-GYN, by moving the screening age up to 40, they're trying to combat some of these inequities because Black women are being diagnosed also much later. So even if you don't have one of this aggressive cancer, if you get diagnosed later, it's going to be aggressive anyway. So it's important that Black women know they need to get their mammograms, they need to come in, need to see their gynecologist, and hopefully by them moving the screening age, we're going to be detecting it early, and hope it's going to help all women, Black women and all women. And the inequities are due to multiple things, but this is one thing that can help. I think there's a lot of awareness and a lot of talking about it.
Okay.
And then going over overall health and lifestyle health, other things that contribute to cancer, diet and high fats and and processed foods. So I think that's the other thing, is that we start talking about that 20s and 30s about our diet and our lifestyle.
Okay. And then also, I hear a lot of my friends and Black women in general talk about dense breasts and that we may
Yes.
need more than a mammogram. Can you speak on that?
Yes, I'm glad you asked that because a lot of patients ask about that. So, and as we get older, the tissue gets more dense, and it's a variation of normal. But on a traditional mammogram, when you get most mammograms are 2D, so it's a traditional mammogram. This breast is like looking through a snowstorm. The picture is very grainy, so you may miss some breast cancer, particularly some little small ones. So, two things you can do: you can ask your provider to write the order for a 3D mammogram. Much better. Not every facility has that. Where I work at Torrance Memorial, they do. As a matter of fact, all of their mammogram sheets are now 3D, which is really great. Some insurances don't cover that one, particularly if the facility has an option for the 2D one. So that's a conversation to be had, but it's certainly worth maybe paying whatever the difference is, because it will get a better reading and maybe a less chance of you having to go back, because that creates a lot of anxiety in women. They get the mammogram and it says that the tissue's dense. Can you come back? Let's do a special imaging. Let's do an ultrasound. Yes, and it happened to me, and I didn't like it when I was on that side of it, let me tell you. Um, so then you're waiting for 2 weeks, 3 weeks to get this follow-up, and you're, going into a tizzy. So getting a 3D mammogram can prevent that. The other option is, particularly if there's concern about insurance coverage or the facility doesn't have 3D mammogram, you can ask your doctor to order a mammogram and ultrasound together. Now, ultrasound does not replace mammogram. I have so many women say, well, I'd rather get the ultrasound. It doesn't hurt and there's no radiation. Well, it's not the gold standard for detecting early breast cancer. So we don't want to just get the ultrasound. But if you combine the ultrasound with the mammogram, you can get a better image and better reading. They're looking at things differently. So that may give a better read on a woman with dense breast tissue. And in fact, most often when you have dense breast tissue and have to go back for a follow-up mammogram, they're going to throw an ultrasound in there. That's what they're going to do. So I have patients that I already know their tissue's dense. We just do it off the bat. I just wear the mammogram and the ultrasound, and then we get it taken care of.
Okay. All right. And finally, as we wrap up, what is kind of the main thing? It is a lot to think about and a lot to
Mm-hmm.
remember, but if you could tell people maybe two or three main things that they need to keep in mind when we're talking about breast health.
Definitely, prevention is key. Early diagnosis. So get your mammogram starting at 40, but talk to your doctor to see if you need to do mammograms or anything prior to 40. Discuss your family history. If you don't know your family history, ask. And breast cancer can be on father's side or mother's side. So both sides can contribute to your risk. So if you are able to, please find out your family history. That I think that's key. And talk to your doctor about self breast awareness, what you should be looking for. Those will be the main things.
Excellent. All right. Dr. Latrice Allen, Torrance, California, thank you so much for joining us. This is excellent information, and we will definitely, make sure that folks get the word and get the word out to their friends, not only them, but their
Yes,
friends and family.
yes, yes. Thank you for having me. I'm happy to come back anytime and to share more information.
And that is this segment of Urban Wellness Now. Thank you so much for joining me, and I'll see you again next time.